self-hip mobilization. This is a technique that we teach our patients that are coming in with typical hip pain, hip arthritis, impingement syndrome, and we typically see a lot of rotation and hip movement restrictions, and we teach them how to do this, which complements what we're doing here manually. So it allows them to be a little bit more proactive in their rehab. What you need to do this effectively, you need a pool noodle. Okay, this is a typical kid's pool noodle. You see it's about yay thick. Okay, so it's about that thick for comfort. Then I cut a piece 12, 14, 15 inches long, and then I cut a seam all the way down the side of the noodle. Okay, this allows us to use, the next item that we need is a yoga strap. You take a yoga strap and you want to close the strap out, and the strap goes in the seam of the noodle, so it is so it's threaded through the noodle. Basically, the noodle is a cushion because we're going to, like I said, we're going to mobilize that hip. Okay, so we have to size this up for yourself. You're going to lay down. All this is done laying down. Okay, so we're going to work my right hip. So this goes like, the noodle goes in the crease of your hip, okay? Then we are working with that. So as you can see, the noodle is in the crease of my hip that I'm trying to mobilize. The end of the yoga strap is on my other foot. But we want to take out some of the slack. That's why I have the ring, the D-rings right here. So I can work it up to take out some of that slack for my size. That would be ideal. Basically, you want to take out the slack to where the leg that's going to push, okay, so my left foot has the strap on it. The right leg is the one I'm mobilizing. Okay. So you want the slack, enough slack out of the yoga strap so that this leg is bent approximately 40, 50 degrees. This knee is bent 40, 50 degrees. Okay. I'm going to grab the hip that I'm actually mobilizing, and I'm going to hold it right here. Then simply, with this leg, push leg, the non-mobilizing leg, I'm just going to push straight down, hold for about 5 to 10 seconds, and ease off. What this is doing, it's pulling the socket of the hip that way. Okay? So I'm going to hold here, and push, hold. If you want to get fancy with it, you can actually do a little small amplitude push. Ease off, relax. I'm going to do it again. You can pull the knee up a little bit, hold, push. Small amplitude push. And ease off. If you want, you can slowly put your hip and knee in different positions. That does stretch and mobilize different aspects of the hip socket. So if I wanted, I could be fancy and just hold it like this. So I'm holding my ankle with my left hand, knee with my right, and this is more of an external rotated position. And the same thing. I hold, pull it up until I feel, and I push down. Small amplitude, and ease off. Repeating that 4 or 5 times. Again, no pain. You feel a slight stretch. It's a very mild stretch, but it does very effectively open up the hip socket. It separates the joint. So if your hip is arthritic, or your hip socket is impinging, you're removing that compression, that irritation, and it is very effective, and it gives you the ability to start being proactive for your health.